Vector-borne diseases such as dengue fever and malaria are major causes of sickness, disability, and death. More than 80% of the world's population live in areas where one or more vector-borne diseases are transmitted. Prevention of these diseases relies heavily on vector control through insecticides. Key tools include insecticide-treated nets, indoor residual spraying, larviciding, and, for Aedes-borne diseases, space spraying. Due to the long-term and widespread use of insecticide-based vector control interventions, mosquito populations have developed resistance.
In order to reduce the high burden of vector-borne diseases, we need to select the right interventions, including the insecticides used in them. To do so, it is vital that we closely monitor mosquito resistance to insecticides.
WHO provides guidance to help countries monitor and manage insecticide resistance in mosquito vectors around the world. This guidance is regularly updated as vector control interventions evolve. Between 2017 and 2021, WHO coordinated a study to determine testing procedures and discriminating concentrations for insecticides newly recommended for mosquito control and to validate former tentative discriminating concentrations. A discriminating concentration is a concentration of an insecticide that, when a sample of mosquitoes is exposed to a surface treated with it for a standard period of time, reliably kills susceptible mosquitoes so that any survivors may be assumed to be resistant.
Some important new developments have been made to support countries in monitoring mosquito resistance to insecticides.
WHO's updated guidance is as follows. 1. Guidance to monitor resistance for Anopheles, Aedes and Culex mosquitoes has been integrated into one document following the integrated approach outlined in the WHO's Global Vector Control Response. 2. A new standard bottle assay procedure named the WHO Bottle Bioassay has been developed for testing mosquito resistance to insecticides that are not suitable for impregnation on filter paper. This is a modified version of the CDC Bottle Bioassay and was developed to align procedures and endpoints with those of the WHO tube test. 3. New insecticide discriminating concentrations have been validated for the WHO tube test and the new WHO bottle bioassays, 17 for Aedes species and 13 for Anopheles species. 4. Comprehensive standard operating procedures have been developed for conducting WHO bottle bioassays, WHO bottle bioassays to test the susceptibility of adult mosquitoes to pyriproxyfen, WHO tube tests, impregnating filter papers, and WHO synergist insecticide bioassays. 5. There is now improved guidance on how countries should plan insecticide resistance monitoring in mosquito vectors and on where and how to prioritize resistance testing. 6. WHO has updated the tools to support countries in capturing and interpreting insecticide resistance data and to track the spread of insecticide resistance over time.
As new vector control interventions are being developed and as resistance continues to evolve and spread, the assessment of resistance to insecticides used in vector control interventions will be essential. This data is critical to informing the selection of interventions at national and subnational levels and to assess the magnitude of the threat that insecticide resistance poses to public health.
Countries should adopt WHO guidance to monitor insecticide resistance and to make data-driven decisions around context-appropriate interventions.
This will help minimize the devastating effects of vector-borne diseases on the health and well-being of individuals, families, and communities.